Question number 1. False regarding mediastinal mass. So if you look at the question, it is very simple. There are 4 statements and you have to pick up a false statement. Thymoma is the overall most common mediastinal tumor. It's a controversial statement. For some author, this is true, but for some author, it is neurogenic tumor. However, for most of the exam, you can consider it as a true statement. CT is a non-invasive screening method for acute aortic dissection. Yes, that is true. CT is considered to be one of the most useful imaging investigation in acute aortic dissection. It is to be noted, if the patient is unstable, the preferred investigation in aortic dissection is transesophageal echocardiography. Neuroenteric cysts are always associated with vertebral anomaly. This looks like incorrect, but please remember this is also correct. Neuro is spinal cord, spinal canal. Enteric is GIT. So it's an abnormal communication between the spinal canal and the GIT. It can only happen once there is a vertebral abnormality. So this is also true. Muga scan is preferred for ganglioneuroma posterior mediastinal mass. This is wrong and that is the answer. So please remember, Muga scan is used for ventricular function. It has nothing to do with ganglioneuroma. Anyways, you need to remember MRI is the most useful imaging investigation for localization of posterior mediastinal mass. If somebody asks me any nuclear scan, it has to be MIBG. Nothing to do with the Muga scan. Small pneumothorax can be best demonstrated by, this is a question that we have discussed in the class also. Answer is chest X-ray in inspiration and expiration. What happens once you expire? The relative volume of the pleural air is much better appreciated. It is to be noted that a lot of research that is coming up now is says that there is not much difference between the inspiratory and expiratory view. But if somebody asks you in the exam, please remember the most useful imaging investigation is an expiratory chest X-ray, also to be noted in erect position. Question number 3. Triphasic waveform on color Doppler is seen. So this was a slight googly. Now, hepatic artery is a visceral artery. Now, you all know a visceral artery has got a monophasic waveform with pulsation, and that's a normal pattern. Portal vein is carrying an arterial flow, but it is a vein. So please remember, it also has got a monophasic pattern. Now, hepatic vein is a vein, but please remember, a hepatic vein is an exception. It shows a triphasic waveform because of its connection with the IVC, which is in direct continuation with the right atrium. The changes in the hepatic vein reflects the changes in the right atrial pressure, and the normal hepatic vein shows a triphasic waveform. So this is one vein which has an exceptional triphasic waveform. So this was a googly for you in the exam. 4. PET scan is least useful for the evaluation of. We all know PET is a positron emission tomography, which is a marker of glucose metabolism, okay, which is telling you that what is the metabolism that is happening. Radiation necrosis, yes, it is indeed very useful to differentiate recurrence from the necrosis. Necrosis will not show metabolism, recurrence will show metabolism. Mesial temporal sclerosis, indeed, it is very useful. The part of the hippocampus that has undergone sclerosis will show hypometabolism, and cerebral blood flow can also be picked. Point to be noted, it has nothing to do with CSF rhinorrhea. CSF rhinorrhea, PET scan has no role, and that's the answer. Next question. X-ray features of ASD are all except. So it is to be noted that we have got 3 acyanotic congenital heart disease. What are these? ASD, VSD, and PDA. All 3 presents with pulmonary plethora. Now, if you do the chest X-ray, the first feature that you see in an acyanotic congenital heart disease is a pulmonary plethora, which is increase in the pulmonary vascularity. Now, you look at the left atrial enlargement, and it is to be noted, if left atrial enlargement is present, one disease that you can rule out is ASD. Left atrium is never enlarged in ASD, and that is what the examiner is trying to ask you over here. The answer is left atrial enlargement.